About health issues now in South Africa and health care issues. The poor state of health in South Africa and the poorest of the poor often bear the brunt of inefficient and insufficient health care systems. Middle-class South Africans are slightly better, though, because generally they can afford medical aid. But there are concerns, of course, around changes around the National Health Insurance Scheme. What could that mean for South Africans? Where are we as far as universal health coverage for all of us in South Africa is concerned? Well, let's get the thoughts of Dr. Fundile Nyati, the CEO of Proactive Health Solutions. Dr. Nyati, always good to have you on eNCA. Let's start with that question of universal health care. Do you feel that's where we're getting to, and are we getting there quickly enough?
Well, thank you for that question. Yes, I think one thing that we all need to know is that South Africa is one of the member nations of the WHO. And there's a resolution there that all member nations should have universal health coverage by 2030. So in line with that resolution at that level, South Africa has come up with its own brand of universal health care, which is called the National Health Insurance. And there is a bill that is before the Parliament Portfolio on Health, which is actually looking at how to make this a reality in the next few years. It was initially envisaged that it will be rolled out from 2026. And that's what we are working on as a country, and there's a lot of divided opinion on this matter, whether actually the NHI as envisaged will actually be the kind of, panacea to all of the challenges that we have in this country as far as health is concerned.
There are concerns as well as to how well the NHI could manage, not just from an institutional perspective, Doctor, but also from a practical perspective, because if we take a look at the state of our public facilities at the moment and the way they're managed, there aren't a lot of people who have great confidence in something like an NHI working. You're simply giving public hospitals a fancy name.
Well, look, I think this process has been, a long time coming. I think since around 2010, where there was real action around this matter. But just over 10 years later, there are still aspects of NHI that are really not clear. Now, one thing we need to know as South Africans is that about 83% of the people in this country make use of the public healthcare system, a system that, former Minister of Health, Dr. Mtwaledi, once described as a system that is in ICU. So it's really crumbling. There are still some pockets of excellence, but it is crumbling generally in terms of the infrastructure, the maintenance of technologies, understaffing, overworked, unsafe working conditions, and all of that. But we must also not, think that the private sector has got all the solutions, because a health market inquiry on the private sector also found that there are serious problems relating to costs, and some of those could actually be traced back to over-servicing, cabal kind of mindset, and it's consuming about 50% of what the country spends on healthcare, yet it's attending to only 17% of the population. So there are challenges of sustainability on both. So we definitely need, a way to address this. But the NHI, as it is, many people are pointing out at certain holes. How is this thing going to be funded? How is this thing going to be, run such that, there is not going to be corruption? How are some of the political agendas, going to be, kept out of the running of this thing, especially with what we've just seen with the PPEs and the corruption that has happened there. So there's a lot of questions, but we certainly need radical change in how healthcare services are delivered to everybody in the country. So the principles of universal healthcare, everybody subscribes to that. That is, everybody should have access to quality, affordable healthcare without having to pay at the point of service. But it is when you take it further to say, how is that going to be achieved, where people have got major differences.
Yeah, it's the usual 5 W's and an H. It's not the what is the question, it's the how, who, when and where, I suppose. Those are the issues we've got to look at. I see on Business Tech, Doctor, there was a poll done by PwC asking an obvious question: will the NHI meet its objectives? There were 3 options given, Doctor. 50% saying no, it won't reach its objectives. 25% saying yes, it would, and 25% saying partially. So not much confidence right now. Doctor, I'll leave this as my last question to you. Why do you believe, and what do you make of the comments around middle-class South Africans concerned about changes that the NHI could bring in? Help me understand that. Why would the middle class, who generally can afford at least hospital plans and medical aid, why would they be concerned? What's your understanding?
I think the major concern comes from the fact that, with the NHI bill as it stands today before Parliament, there are, it actually doesn't see a role of the medical aids as we speak. What it sees is what it calls voluntary, complementary top-up schemes. Of something that is, of anything that is not covered by the basic package of NHI, meaning the viability or the presence of medical aids going forward is unlikely to be there, and so that is the problem. So most people in the middle class, they are saying, so are you going to force us to go to these hospitals that we believe are providing substandard care? And that is the anxiety, and that anxiety goes beyond just the middle class. But also, the actual practitioners in the healthcare system are saying if we are forced to work in that kind of system, we are likely to emigrate, as evidenced by studies done by PPS and also even by SAMA. So there are a lot of anxieties, and even those who are for NHI, but who may need services beyond what the NHI basket is offering, they are saying we may not be able to afford those top-up schemes. So there is that general anxiety amongst the people in the middle class that their options as far as healthcare is concerned may be limited, and they may be forced to a service that at this moment do not feel inspires confidence if they look at what the public health system is providing. Even though NHI will actually procure services from both private and public sector, facilities that are accredited.
Well, I appreciate your time, Dr. Fundile Nyati, as always, joining us. Proactive Health Solutions CEO, talking about universal health care. It's low income versus public hospital usage versus middle class to upper class and medical aids. Could there be a combination? How do you feel about that? We'll, I'm sure, ask that question in the next few days. Here's none.